So welcome, we're here. Health Equity CT. You have to say that T
Health Equity
appropriately.
CT.
Yes, you know, I think when we say the title Health Equity, people think it's like a messy conversation, T spelling, and it's not.
Yeah.
We can't, we're not doing that.
No, we're not being messy.
No, we're being constructive and helpful, especially. Before I go any further, we have to give a shout out to our sponsors, the Connecticut Health Foundation.
Yes, thank you.
Thank you, Connecticut Health
We love
Foundation.
you.
This is made possible by a wonderful grant from them, so we are really happy that we're able to do this and talk about health equity in the state of CT. Health
CT.
Equity CT. I'll say it again. As you know, my name is Lawrence Young.
And I am Stephanie Clark.
And we have two legends with us today. Yeah. Legends here today. Today we're talking about what's the T with local public health. Local public health is a huge factor, a huge, I think, driver of health equity in the state. And so we really want to highlight the work that they do and talk about two very important districts. So I'm going to let you introduce yourselves and tell us what district that you're from, starting with my friend right over here.
So my name is Patrick McCormick. And that's P-A-T.
That's right.
And I'm the Director of Health at the Uncas Health District. So we cover 11 communities in the northern part of New London County. And Norwich is the sort of the hub of those communities. So we kind of cover a urban, rural, suburban, mix of communities. And I've been there for just about 20 years now. Wow. So it's been a while.
Such a legend.
I'm not legendary.
Alrighty.
Okay, and I'm Jen Muggeo. I'm the Director of Health with Ledgelight Health District. So we cover most of the other towns in New London County along the shoreline, up in Lyme, Ledyard, North Stonington, Stonington. Should I list them all now? East Lyme, Groton, Ledyard, Lyme, New London, North Stonington, Old Lyme, Stonington, and Waterford. So there's only one town in New London County that's not part of either Uncas or Ledgelight Health District. And I have been there for 19 years, but I've been the director for almost a year now.
Sidebar, did she just list all the towns alphabetically?
This is what I said, legend.
Okay.
I don't just throw out the term legend, like just walk around calling people that. You know me, right? When I said legend, I meant what I was saying. We don't have anybody here showing up. Wonderful stuff.
That's impressive.
It was. You rattled them off well.
Foster Franklin,
Yeah.
Norwich, Salem, Sprague, Ballantyne.
Say it again.
Right.
Say it one time.
And Preston.
There you go. See, that's what challenge accepted. See, that's what legends.
And you know why we had to do that was because if you don't do it that way, somebody will say, why are they first?
Yes.
Or why did you say that? And so we want to make sure everybody knows that it doesn't make a difference where you live, that we represent everyone the same.
Yes.
Promoting equality.
Exactly.
Not equity yet, but we're going to get there. There we go. So tell us a little bit about, and this is to both of you, and you chime in freestyle with this, but about your role as a local health director. Like we know about the health department. You only really know about it until you have to deal with it. Mm-hmm. But like for people who just have never had the privilege of dealing with their local health department before, what is the role of the health department and the health director?
Go first?
Go ahead.
All right. Well, so it's funny. I remember when I applied for the job here, I talked to another director of health and said, what do you think? And they said, well, you're basically the CEO of a small company, and your company is public health. So that's where I started to realize what a health district was, because I came out of Massachusetts. And in Massachusetts, it's a lot of municipal departments. They hadn't really regionalized at that point. So we had the good part, and what towns and municipalities like about us is we handle our own legal, we handle our own insurance, we handle our own vehicles, we do. So I've had one selectman say, my goal is just to hand you the check and let you handle public health. And if I get calls about public health, then I'm probably, you're doing something wrong. Mm-hmm. I've also said that we're sort of like an umpire in a baseball game, that nobody knows we're there until we make a bad call, and then all of a sudden everybody's all over us. But our role is to keep our communities healthy, and our communities can be variable from time to time. We may have people that visit us, we may have people that are living within our community, we may have people that don't want to be recognized as living in our community, that live in our community. So those are all folks that we need to make sure that they stay as healthy as possible. So.
Yeah, and so how we make sure they stay as healthy as possible encompasses really broad range of activities and services. So a lot of people may know us, like you said, they don't know about the health department until they interact with the health department, but most people at some point have probably gone into a restaurant or a hotel or a pool or something like that in one of our service areas, a salon, tattoo parlor. And so, one of the things that we're thinking about in keeping people healthy is inspecting all of those places and following up when people have concerns about the conditions there, and helping those businesses learn how to operate their businesses in a way that will keep their patrons as healthy as possible. But that's just, one very busy bucket of work and thing we're thinking about when we're keeping people healthy. We also are thinking about how, both waste and water and whether people have on-site subsurface sewage systems or septic systems, and on-site wells, and helping them to make sure that at home they're safe, or at home they're safe if there might be lead in their home or radon in their home or some other things that they need to be thinking about at home. But those are just a very small portion of all of the things that we're thinking about when we're thinking about keeping our communities healthy.
They used to say when you've seen one health department in Connecticut, you've seen one health department in Connecticut, because none of us look the same. And I used to see that as a negative, like, great, we're all different, you never know what you're getting. But then I've come to find that it's based on the fact that we assess our communities independently, and we try to meet the needs of what our community that we're serving needs at the time that we're serving them. So it may be that Ledgelight Health District has different needs in their community than we have up in our area. And what we're looking at is some commonality so that people don't get confused. So we try to show the base of things that we offer, but then some of those things may vary from place to place based on the needs of our community.
So what initially drew you all to a career in public health, and how did you find your way to being the director?
So in my case, my mother was in public health from the time I was a child. So my mother was the public health nursing director in Waterbury for a number of years until she retired. She ended up actually working at St. Francis Hospital for a while, running the clinics there. And then she was loaned out to the city of Hartford and became the health director at the city of Hartford for a period of time. So I had that experience growing up, and I never wanted to do what my mother did. And then as I went through school, and I still didn't know what I wanted to do, and I was thinking I wanted to get into healthcare, medical field. Then next thing I knew, I graduated with my undergraduate degree, and my mother said, well, you've got a couple choices here, what do you want to do? And that's when I ended up applying to a Master of Public Health program. And that led to sort of the direction of getting into local health, and it stayed the same for all the years I've been in my career. So that's how I got into it. I sort of stepped into it without really expecting to.
Yeah, and my experience is completely different, because growing up I had no idea I had never heard the term public health. My undergraduate and early career was around business administration and running the operational side of things, making sure everything was going smoothly with the accounting and the HR and the tech side of things of running an organization. And I was on the West Coast and relocated to the East Coast and was just looking for a job, putting those skills to use. And the Ledgelight was looking for somebody to fill that role at the health department. So when I interviewed, I was very happy that I was taking that skill set that previously had been used to support a for-profit entity and making a business owner more economically well off, that I would now be taking those skills I had developed and putting them to better work in my, to support creating a healthier community. And saw my place in this behind the scenes supportive role. And then we had a pandemic. Not the pandemic everybody's thinking of. We had another pandemic everybody forgets about in H1N1. It was kind of all hands on deck, and I was not in that supportive role anymore. I was having to make some public health functions happening, and I was like, oh, okay, I'm really interested in this. And so I had been pursuing my master's in public administration, and I switched my program to finish my master's in public health.
Excellent. So what are some of the biggest challenges that you find in your role as a health director, particularly as it relates to health equity?
I think that particularly as it relates to health equity is that is understanding the difference between equity and equality. As units of government, and that's what we are legally and functionally, and as part of like this system that operates on taxpayer supported funding and rules and regulation, and we can be very grounded in equality, so that there's no perception that we are treating people unfairly in terms of, well, we're going to make you follow this rule, but we're not going to make you follow this rule. But when we're talking about community health work and addressing health equity, that doesn't work. That's not how we advance health equity. We have to recognize the individual situations and people's individual health goals, not just their health needs, but their health goals and what is important to them, and what we can be doing to support those individuals for whom those systems really are not working. So in terms of, there's great opportunity there in our role as the local health department, because we're talking about people that we know, our neighbors, the people we see at the grocery store, the people that our kids go to school with. And our opportunity is great because the relationship's there, the trust is there, and the desire for us to partner and work together with our community members to learn from our community members and follow their lead and use our position at certain tables to maybe bring resources, but to follow the community's lead in how those resources are used. The systems are not set up to function that way, and so sometimes the systems stop us from doing that effectively.
Yeah, I mean, I think I'd further that discussion. I think, it's been interesting as I've evolved in local public health, and I think I'm getting a better understanding of what the community needs and what the community has to deal with based on the history of where they are as an individual or as a community. And then I go back and I have to do something like my annual report. And all the state or the towns want to know is, how many food inspections did you do? How many septic inspections did you do? How many well inspections did you do? If I'm trying to make a difference and we find there's a need in the community, well, what's going to pay for it? Who are you going to use to do it? Are you going to use money from this that should be paying for a food inspection to do that? Well, you really need to do the food inspection, or the legislation doesn't allow for you to do this, or you can't make a difference in that way because that's not the role of local public health. And I feel like we're constricted a lot with that type of thought process within our communities, within the state, and that's difficult to overcome because I have staff that are incredibly connected to the community. They see every day by their work what is happening in the community, and they want to make change. And many of them now, fortunately, come from the communities that we serve, which we didn't always, we couldn't always say. And they're identifying things that we should be doing. We should be doing, not we can do, it's we should be doing. And it becomes difficult as a director of health to say, well, I know we should be doing it, but I have to find the money to do that, or I have to find the right person to do that, or I have to find the right partnership to work with to do that. And I have to hope it's not a 1 year or a 3 year plan to be able to accomplish those things. So it's really selling the community on the fact that we're more than what they thought we were in the past, environmental health. You know, when Jen talks about her background, when I came into the field, a lot of the health directors were former doctors or doctors, former sanitarians, a few nurses, but they came out of the field. And you really, again, have to be able to manage grants. You have to be able to manage staffing. You have to be able to communicate with people. You have to know what resources are in the community. I don't see how somebody can, and they do, and I give them a lot of credit, but I don't see how somebody can take this job like I did and come from another place, because it's all about building relationships. And honestly, you have to rely on those other people to help you to sort of foster whatever community support you can get going forward. And it's really, they always say, does it take 3 years to get comfortable in any job? And I'm still not comfortable yet, and I've been here 20 years, because every time I think I got it, then something else comes along that we should be doing. So I rely on folks like yourselves to be able to educate me on what the community needs, because I'm not out there all the time. I'm sometimes sitting behind the computer or the desk, and I can't get a feel for it. I'm looking for data to drive our work, but it really is the touch point and the social part that I need to be more involved in.
So, you know, I want to talk a little bit about, I think this is really great stories to highlight about how public health equity has evolved so much over the past, I mean, even since post-COVID, post that particular pandemic or whatever we were to call it today, things have changed so rapidly. But I do want to talk a little bit more about some of your personal experiences. I want to now it's tea time, Stephanie.
Yes.
And really nothing, you know, you can go where you want to go with it. But tell me a personal story, or tell us a personal story or an experience that really reignites your commitment to health equity during the tough times. Like just like something that happened, something that we can take a moment to think about it. Stephanie can hum a little something while you process that question. But just something that sticks out to you about a personal experience during this time that, like you say, that this made me think about health equity differently. It reignited my passion for it. I'm doing things differently. I'm, shifting back. I'm engaging new people. I saw an issue that uncovered that I didn't know happened before. Just anything like that. You're nodding, so I think something's brewing over here.
Yeah, I think a lot of things are brewing. So I'm trying to pick which one answers all of those questions, Lawrence. That was a lot.
It was a heavy one. I wanted to just drop that and let it marinate.
This scenario says this, but not that. One happened this morning, right?
Love it.
A community member texted Stephanie, who texted me and some of our other team members, who said, there's somebody experiencing a crisis in a public setting. I can see this happening. I can see that the people that are around her are not providing her with support. I'm worried about her, but I don't want to call the police and have that be the response. And so luckily our team members, who are community health workers, were able to go and check on this community member and de-escalate the situation in a way that was safe for everybody involved. And that's not a box we put on our annual report. How many times did you intervene and avoid a police response, right? But it is definitely part of our health equity work and part of our making our community healthier. And I don't want to imply anything about our law enforcement partners in this conversation, but in that situation, that a law enforcement response wasn't what was appropriate for anybody involved, and oftentimes, that's all people think they have access to. So building this system with our community navigators and our community health workers, and some of the work that we're doing under our violence prevention grant in terms of training community members in response, building their capacity to de-escalate situations and support their neighbors in ways that keep everybody safe, that don't involve, calling the police is not always the answer, and hopefully not always the only possibility.
I'd love to highlight too how the local health department can be a resource to the community. I think one of the tools and one of the goals of this podcast experience is to talk about like resources that we have and thinking about health, because a lot of people, what I've been finding, are doing health equity work and won't even call it that, or don't know to call it that, and like seeing that as an issue, how we navigate it. So thank you for sharing that. So yeah.
So we both have collaboratives within our two regions that we serve. We have the Eastern Connecticut Health Collaborative in our area. You have the Southeastern Connecticut
Health Improvement
Collaborative of Southeastern Connecticut. And with those two collaboratives, we've been able to start working together with our community partners. So when I started here, I remember there was a lot of discussion about how we can help the community. And a lot of the work was around making community connections, because hospitals had to be able to keep their nonprofit status. So we needed to be able to document that we were out there meeting with people, and they were really just looking for raw numbers. How many brochures did you hand out? How many people did you connect with? There really was no plan. There was really no final destination for people, how we can get you to better health. It was really, watch out for Lyme disease. If you have concern about breast cancer, here's information. But then it was kind of lost at that point. And the other piece was that we were told you want to keep people out of the emergency room for unintended emergency room visits. Well, there was a reason people were going to the emergency room, because they couldn't get care anywhere else. And they didn't have the ability to be able to take time out of work to go to a doctor's appointment. And there wasn't a real prevention effort being made. It was really just in response to somebody getting sick. So now with the collaboratives and the work we're doing, we're partnering now where we're going out and doing the mobile health hubs that we have up in our area. And in our area, we collaborate with a lot of the same people, and a lot of us collaborate with the same people no matter where we are. But we are working with the hospitals, and we're working with the soup kitchen, and we're working with the shelters, and we're working with the community care teams, and et cetera. And we're showing up at the same location. So we're going, for the first time ever, we're going to where the people are, and we're bringing them resources. And then while we're there, hey, do you have any questions about the services we provide or the services they provide? And maybe we're connecting you to books at the library, or maybe we're connecting you to heating assistance through TVCCA, or maybe we're connecting you with something, you want to start a business and you want to talk to us about how you can do that as a small business owner. And so our goal is to make your life better, so that all of those other parts of your life can improve, and then hopefully your health in general will improve as well. But we want you to know how to get a hold of us, because they don't always pick up the phone and call our main number, but they'll connect with you in the community, and they'll know you in the community, and that makes a huge difference to people. They're not just going to call a random number. They want to know that Stephanie's going to be able to come and help me, or Jen is going to help me, or I know Patrick from these things I go to, and Patrick will help me, or somebody on his staff will. And so those are the connections that we're trying to make now, is out in the community. And we've done a lot of things, like we'll do the screening, and then if they're positive for something or it's concerning, we hand them off to the hospital. If they don't speak English, we have a translator there. If they need food, we have food there. So we're letting people know that we're not here to be invasive and to say, oh my God, you're sick and you need to get some help, or you have this issue and we need to help you. And I can't believe you smoke. Now we're going to give you a smoking cessation program. Well, obviously people that smoke have stress in their lives, and there's other things that are happening. How can we help you with all those other things? Because chances are you're not going to quit smoking if we don't help you with all those other things. You're working 2 jobs, you have 5 kids, you're living in a single bedroom apartment. During COVID, I saw the disparity between people, and it's such a simple thing, but when we were telling people to shelter at home, and I was telling a person in one of our towns that has 3,000 square feet and 3 acres to shelter at home, and I was telling somebody else with a family of 5 to shelter in a 1-bedroom apartment, what am I telling people?
Right.
So I think that lack of understanding of the community and the people we're serving, and to say, oh, you're not as important as that person because we're telling you stay in your house and don't leave and there's nothing we're going to do for you.
Right.
Or you're sick and we're not going to provide you with support. Now we'll say, there's opportunities. If you can't leave your house, we're going to make sure you have food, and we're going to make sure we talk to your employer to let them know that you can't come to work, but we want to work with you on making sure you still have a job. And we want your kids to be able to go to school, and if they can't go, then we want to make sure we get access to education. And all of those things we didn't do before, but the amount of effort and time involved for one particular person, that's the struggle that I have, is when our staff go out and they say, I went out to this apartment for no heat complaint, and I have a list of 50 things this person needs. You don't know what to do sometimes. Do I try to help them with those things, and then I have to defer other things because you only have so much time in a day? And a lot of times it's no, we have to connect to those other agencies or people that can help that person. And then we'll just deal with the heat issue, but we'll make sure that they have those connections so they can deal with everything else. So that's what I've been seeing as successes, is being able to evolve as a health district to where we have now a different approach to how we take action.
I love that. I was worried about that question in the beginning, but y'all did good.
So I have another question, but I'm going to tell you right now that I have a Patrick story.
It's a good one, or an okay one.
So it starts off and then it kind of like dips, but then there's a happy ending.
Okay.
So we'll probably get there, and I don't know if it'll make it on the podcast, but I just want to tell you that I have a Patrick story.
Okay.
So
I'll prepare myself.
I was ready. I was like, I think we should tell it. I'll take you to tell it.
Okay.
Yeah. I'm like, is it tea? Yeah. I was like, I can take something. Go.
So there's a little bit of tea.
Yeah. Whenever you tell it.
And a little coffee.
So when I was at the health district before, we had a grant from the Department of Public Health to reduce risk factors for Black folks in the region.
Yeah.
And so Legislite had it, and I think in our second year, our second round of funding, I think that Uncas got it. And so we had a in-person meeting. I don't remember where it was, but one of our program officer met, and he was like, could you mentor some of our new grantees? And I was like, yeah, sure. And so then you hired someone, and he was like, we talked all the time. He's like, I can't get into these churches. And I'm like, well, okay. So I know of a church because I knew the pastor. She used to babysit me when I was little. So I've literally known her since I was a kid. Yeah. And I was like, so why don't we do this? I'm like, I want to introduce you to her, and I'm going to talk to her, introduce you. He's like, no, I don't have the money for this. I don't have the money for this. And I was like, cool. I will cover it through our grant. And I'm just going to show up and say, hey, you guys know me. This is my friend so-and-so, and we want to do this, this, that, and the third. And we had it all set up, and then you shut it down. And I was just like,
that
Patrick hates it. And so when he called me, I was like, well, why? Yeah. And he was like, well, because you're Legislite, this is Uncas. And I'm like, that doesn't make any sense though, because people who live here go to church out there, and vice versa. And so I was like, oh, I don't like Patrick because Patrick doesn't like Black people. That's the story I told myself.
Yeah.
True story.
Yes.
So then when I saw you, I was like, hi. And I was always thinking,
what a jerk.
Right?
That's okay.
So then we fast forward, and I did, after I left Legislite in 2014, I did a 9-year tour in philanthropy. And so I was still part of the Health Improvement Collaborative and all sorts of health things, because that's really my passion area. And so then I'm back at the health district again, and I don't remember the first meeting where we all were, and I was like, Patrick's still there, okay.
Darn it.
So I was like, I wonder what this is gonna look like. So I actually had a conversation with Jen, and I was like, I think I'm just gonna be really quiet in this meeting, because I still have this this thing that I'm holding on to.
Yeah.
And then so she was like, so let me talk to you a bit about that. And so again, like you mentioned today that you have been at Uncas for 20 years, right? So that's like, I feel like if I had stayed in public health, I'd be like right behind you in years. So that means that like we were significantly younger and like newer and greener into, and so I think that maybe there were some territorial things happening, and then
you don't think there were.
okay. And she was talking to me about like how like you all have been working together, and I was just like, all right, well, I'm gonna give him a chance then. And so then we go to like one meeting, and I'm like, oh, I see a new side of him. But I'm gonna wait. And then we had that training in East Lyme. The social media in crisis. And you were asking so many questions, and I don't mean that in shade. You were asking questions because you were like, I don't know how to do this, or I don't have the capacity to do this. And I thought that was like so courageous of you, like to be like, I hear what you're saying. I can't do that. And that's huge for someone like in your position. And I told Jen, I was like, oh, I think I like him now. So, but then like we spoke briefly that morning, like before you started asking all those questions. I was just like, oh, there's like a whole new Patrick. Okay. And then like we made jokes because there was like one of the things they said, you don't need to say this 100%. Remember? And I was like, oh my God, I say that all the time. I still say that.
So do I, 100%.
Right. But I just wanted to share that with you. So when you were talking about earlier, the last question that Lawrence asked about like how you were talking about like building relationships and how critical that is, Joe just seen me. So I just want to let you know that like I see the growth and like the difference in you. So I just wanted to share that with you.
So my comment to that is, I think hopefully people are open-minded, and that's the part I always ask people is to just understand that we're all coming from a different place at a different time. And I appreciate the fact that you said that, and I wouldn't say that you were necessarily wrong with most of what you said, because there was certainly territorial. And when I started this job, I remember meeting with the health director at the time, and they said, look, I'm willing to help you in terms of your information and learning what the job is and what have you, but if there's a grant, I'm going to get it. And if there's an opportunity for a town, I'm going to get it. And if and that was the mentality, wasn't like what's best for the community. It was really about like, we're going to take this and this is going to be ours, and they're carving it out. And when I got hired, the first thing I was told to do was add towns. You need to add towns because that's the only way you can, because there was always this fear at the state level that I used to hear, if you had 5,000 or more people, or 5,000 or less people, you were probably going to be disappearing at some point. And then I was hearing if you had less than 10,000 people, then I was hearing 100,000 people, and I was hearing if you had less than 5 towns, then I was hearing if you had less than 10 towns. And so there were all these things, and when I say disappearing, it's that the state doesn't fund you. But if they don't fund you, if they don't acknowledge you, then all of a sudden you're not able to apply for the grants, you're not able to. And we were trying to turn the page with a district that was struggling at the time I got hired. So from my perspective, there probably was a lot of concern that any appearance that we weren't doing our job as well as you were doing your job was going to reflect on my organization and impact my staff and impact our ability to function and grow and get to the point we're at today. So I think it was less about me and working with you and your community and everybody that you were, and I appreciate you saying something, because you had a relationship with somebody and you took advantage of that relationship to help me, and I didn't take advantage of that relationship out of respect for you. So I apologize for that, because that's hard. You had a relationship with somebody, you were willing to offer that to me, and we didn't take advantage of it. But that was the dynamic we used to work in. And then there's been another health director I worked with that was somewhat similar in that type of fashion. And then I worked with one that came after that we worked much better together. And now it's evolved. And I think we're at a point now in our relationship as health directors where we respect one another. And it's from a place of respect. And I'm less fearful, and maybe it's age,
Yeah.
You know, I'm at a point now where it's like, you know, I don't have anywhere else to grow.
Right.
Right.
So that makes life easier. I kind of have a better feeling of the community that we serve, which
Yeah.
makes things easier. And I know we can partner together, and we're not
Absolutely.
always trying to step on one another's
Right.
toes, which makes a huge difference.
Yeah.
So I think that place of respect is probably what allows me to be more or less stressed
Yeah.
when we talk
yeah.
about those things. But as a person,
Yeah.
I appreciate you, and hopefully you respect me, and we appreciate each
100%.
other. And that's the thing, is I don't think always the business
Mm-hmm.
of us
Right.
and the personal of us necessarily are the two always the same.
Yeah.
And that's the hard part, is I would hate for you not to like Patrick.
Right.
You know, maybe the health director, Patrick, you know,
Yeah.
I can understand, you know, he doesn't work well with us, he doesn't do his job well, whatever, that's fine. But I would be heartbroken if I didn't think that you would like me as a person, because
Yeah.
I think you and I would get along great.
Absolutely.
So,
And so what I want to say is I love that I see collaboration happening. Because I've been a person the whole time, even when I was there before, I was just like, I don't care about these little squiggly lines that divide our districts.
yeah.
And I say that to my friends that work at the different hospital systems
Mhm.
and the different FQHCs. I'm like, I don't care about any of that, because we're all each other's neighbors. Like, we see each other in all these different social settings. We worship together, we play together, we socialize together. And so as far as I'm concerned, if you have something and you need something that I can help bring to the area, call me, text me, email me. I'm gonna do it. And I don't care that it's, you know, I'm Ledgelight and you're August. I don't care about that, because if there's a need, I wanna help you. And if it's something that you don't have the capacity to do and I can, I'm gonna 100% talk to my boss and be like, hey, so there's this opportunity here. I think that it would look real, not just for the optics, but it's also like good ultimately, like for the community, to improve community health and all that stuff. So
Well, the part I learned
love
too
that.
is operating in a silo can be very hurtful to myself.
Mm-hmm.
Because I've always, you know, sometimes I'll reach out to Jen about a business question, and it's just saying, is this happening to you too?
Mm-hmm.
And how did you handle it? And what would you recommend that I do? Because I know you come from that background. Or, you know, we always talk about the, you know, opioids and, you know, the ways that Ledgelight is dealing with this issue, and you're just, you know, far ahead of where I would like to be in terms of managing this issue. But I've used that to my advantage to say, you've led the way. How can I benefit from all the things that you've learned before I've started getting involved in this issue? And you've been wonderful to us to let us be a partner. And that's an issue where, again, you know, it's not that, you know, we're going to be looked at as we were late to the game. We want to improve things, and ultimately we want so much improvement that our communities are, as a whole, are better. And we've always talked about, you know, people live in Jen's community that work in my community, people live in my community that work in yours likewise. So there is no real, you know, it used to be the thing I used to always hear was there's the northern tier of New London County and the southern tier.
Right.
And they made it sound like we can't go from place to place.
Right.
Well, guess where I go on the weekends? I come down here.
Yeah,
I go
yeah.
to, you know, I go to East Lyme, I go to Mystic, I go to New London, I go to wherever. I want something different. I want to see different things. I want to, you know, so I come down this way. Nobody's ever stopped me in Montville and said, you can't go any further. So I think we've learned that, but that was what I was, and that's what I was taught when I started. I mean, I was 29 years old when I got this job, and I was being told by people that were doing this for years ahead of me that there are lines in this state, and there are borders, and they're understood, and you can't step over them without asking permission. And I understand, you know, being respectful and saying, you know, I'd like to do this. But to say absolutely not, I don't want you coming into my community to make my community better, that would be the worst thing I could do for both of us.
Right.
So.
And, you know, I appreciate so much of everything Patrick just said, and we all have different expertise, and none of us can be all things to all people. And, you know, Patrick has this wealth of experience and knowledge in environmental health that I don't have. Like, it may be changing now, but as Patrick mentioned before, a lot of the times when we both started 20 years ago, most of the directors of health were sanitarians. So I don't know whether I'm one of the few who are not, but I know I'm in the minority in terms of health directors who are, I don't have any environmental health credentials except phase 1. I can sign off on a B100A. I can't technically do a food service inspection or anything, right? And so I have a great team of the people who have those credentials and have that expertise, but when, are we swearing on this, Patrick?
Sure.
When the shit hits the fan, it's my name on that public health order, right?
Right.
I've got to sign off on that, and I've got to be confident in what I'm saying when I'm telling somebody to do.
Right.
And so, the first person I'm calling to double check on that is Patrick.
I love that. I love the tea. I love the Health Equity After Dark. Season 2 of the show is grudges in public health. That's a nighttime show. So I'm looking at my producer Frank. That nighttime show, public health grudges, and how we solve them. We might not solve them. I think we should get people who we know have beef and make them talk it out. That's the nighttime show. No, but I love
with
that.
wine.
With wine is a must. I think because we would solve that. That was a beautiful story, and I think full circle moment about how we have the perceptions and not understanding what happens. I think we had a pre-conversation before we started about just things I promised I wouldn't mention on camera, but just the historical. But I think when decisions are made, why they're made, who's made them, resources buried, and even like just with the COVID work, it was scary. And what did that mean? And so we can talk about that all day. But I do want to talk about, you all. I just am so excited to have both of you all here to talk about what is like the most pressing public health issues in your issue. I'm gonna let you say one in your community right now. Like what's high on your mind right now?
I feel like
they're all just so
say,
tied together.
Go.
I
Okay,
knew
tell me.
it.
Yeah, tell me.
Okay, well, I'm worried about respiratory illness. COVID hasn't gone away. People are still getting very sick. I'm worried about what the this cultural phenomenon that has happened that has led us that everybody just wants to ignore COVID and say, you can't wear masks on the New York City subway because it means you're a criminal, like this anti-public health measure, and what that means for the next wave of infectious disease that we're facing, which is very possibly going to be a pandemic of bird flu. I'm worried about that and how it ties together with all of the things Patrick mentioned before about some folks in our community who can't protect themselves because they're in dense housing and because they absolutely have to go work their 3 jobs to put food on the table. We haven't solved any of those public health issues. I'm worried. We have a new climate change grant starting and thinking about climate change as a public health issue and how that connects to our violence prevention work. And, when we're talking about this crisis that is on, you turn on the news at any time and somebody's talking about the youth mental health crisis, right? And a lot of people try to pin that to schools being closed for a couple months during the beginning of the COVID, but it's so much bigger and deeper and broader than that and predates all of that. We were just ignoring it, right? And so like when we're talking about youth behavior and why it seems like young people are disconnected, and speaking a little bit very personally as the mom to 3 teenagers right now, right? Like, why should young people be connected to us in the frame of our expectations? Because what is the world that we are handing them? It's on fire. It's literally on fire, and we're just pretending it's not. There's literally a deadly virus being passed around that we're just ignoring. So why should they take their AirPods out and say, yes, ma'am, thank you very much, when we hand them a piece of bread? I mean, like, we're not giving them something to be hopeful about. And so our violence prevention work and you know, the idea that there's these 119,000 disengaged youth in our we disengaged the youth.
Right.
The youth are not disengaged. Is connected to our climate change work, which is connected to the increase in infectious disease, because viruses are evolving to our changing climate much better than we're evolving to our changing climate. And all of it's connected to all of the systemic barriers to housing and food and all of that. So I don't follow directions.
I love it. You know, and I hate to, in my head, and I'll be frank, I was saying this, I loved that response. And I'm not like, this is truly a public health horror story. I hate to pass. I mean, but I think, and I appreciate you connecting because all of it's so interconnected, what we do. And I think that's like a grad school level example about how it all matters. I mean, you really went there but I can't wait to watch this back to almost draw a diagram. No, I mean, like, you took us from mental health to COVID to climate change to disengaged youth back to mental health. You did a full circle. Was that me? I love linear thought. This is like so much dissertation. So, you know, I think this is what we want here. Anything, and I hate you have to come after that, but you know, but we want to know from you, from your perspective, you know, what is most pressing? Because what's keeping you up at night?
Yeah, I mean, keeping me up at night, honestly, is being able to sustain our organization at this point. You know, we've always talked about the fact that when there's a crisis, all of a sudden everybody raises awareness. We start seeing funding. They want to support us. They want to know how we can develop our workforce. But the reality is that money is fleeting and it doesn't last.
Right.
And my concern is that we're seeing less and less people get into the public health workforce. The salaries aren't meeting the needs of our community of public health professionals. The cost of running a business like ours continues to increase like it does for everybody else. So, you know, as little things, fuel goes up, postage goes up, insurance goes up, legal fees go up, the cost of our lease goes up, all these things. The income associated with our agency, everybody expects you to just keep operating the way things have been. It's hard for us to talk to our state legislators and our state health department about the fact that we can't sustain this forever, and we can't live off of grants that are short-term grants, a year, 3 years, 5 years. People don't want to work on grants like that. You know, you don't want to know that your job is going to be over in 3 years. You want to know you have benefits. You want to know you can support your family. The housing crisis that we're facing is being faced by our own staff. So how do I tell somebody that, you know, I can't do an increase for you in your income this year when you know that you have to pay the mortgage and you know that your kids have to go to school and they have to feed them and they have to do all these things. And people should be able to live a minimum standard of living, regardless of who you are. And we are all trying to figure out the best way to support one another. And I think at the very heart of it, it starts with our staff. You know, we want to make sure that we're taking care of our staff, and it's really hard to do in this environment. And we're asking more of them all the time. So when the mandated blood levels are dropping, when we're having immigrants that we have to help with TB, which has been in the number of 100 in the past 3-4 months, and it's not a fault of the system that's providing these folks to us. It's the fact that we knew this was coming and we didn't prepare for it, and then we're not funding the support that these folks require. And I always say you can't keep taking from one program or one activity to give to another. Eventually something fails. So we've got to figure out a way to support local public health in a sustainable way for years to come. And you can't be at that point in your career where you're like, well, you know, I'm almost at the end of my career, so I'm going to move on, and that'll be somebody else's problem. I don't want to be that person. I want to make sure that we develop a public health workforce and make sure that we have sustainable activities. And I don't want them to say, well, you know, Emily was really good when she showed up on the mobile health van, Can she come tomorrow? And I'll say, well, no, her grant got cut, and I'm sorry, the mobile health van we can't afford, so it's parked in the garage right now.
Right.
We need to develop these programs so that they can continue to grow and help and support our communities. So that's my fear, is how do we make sure that happens? And I think, having strong planning and long-term planning is the way to go in the state, and not treat everybody as if they're different.
Yeah.
We all sometimes feel bad that, well, the Hartfords and the Bridgeports and the New Havens and the Waterburys, they get all the funding and we don't get anything. And then you get the Hartfords and New Havens and Bridgeports to say, well, we have all the problems and you guys don't have any. And it's like, well, that's not true either. And and we're all kind of like in deference with one another. And it's like, look, we all have issues, and the grass is never greener on the other side. I don't necessarily think that your life is better than mine, or so how can we support one another to the best of our ability? And that's where it comes at a state level. That's where it comes at a federal level, and figuring out how to sustain us for the long term. We just had a $30 million allocation of funds to support one of our programs at the state level for all local health, and it got cut by a third in the middle of our funding cycle. So the expectations are growing, and yet they just took the funds. And when we asked why the funds were taken, they said, well, state funds were taken and we had to replace it. So what does that make us feel locally about what the state how the state views us?
Yes.
Well, we needed to sustain ourselves at the state, so we took from the local health allocation. And you feel like, I understand what you're saying, but that doesn't make me feel better to know, oh good, our state organization is sustained so that you can, you can take from us. You're asking the same amount of work, support us in the same way.
I think everything you just said, Patrick, is so key when we're talking about health equity or just equity writ large, right? And it's, I driving here, there was a conversation happening on NPR about the school districts that are somewhat in the same place that the local health departments are, that like during the height of COVID's not over, there was like this huge influx of federal funding, supposedly to allow local health departments, to allow local school districts to stand up programming to respond to COVID, whether that was at the local health department level, building staff capacity in terms of language capacity and community health workers, and expanding public health nursing teams, and expanding epidemiological capacity so that we can monitor what's happening with our communities, improving our communications, or at the local school district level in terms of setting kids up to learn in different environments and connect with learning in different ways and access mental health supports and social emotional learning. And now there's this expectation that, well, COVID's not as bad, that funding's ending, you shouldn't have started those programs when you knew this was a short-term funding.
Right.
Well, guess what? All of the things that those programs addressed, maybe they did it with the COVID label on them, but they were long, persistent gaps in our services to our community members. And they haven't gone away.
Right.
And we built up these infrastructures and built capacity that we need on an ongoing basis, and we're definitely going to need during the next disease outbreak. And the expectation that because COVID, we've got vaccines now and COVID rates aren't as bad, that we're just going to dismantle this public health infrastructure that was a long need that we finally for a few years were given funding to build.
Yep.
That we're just going to take it all down and do the bare minimum and then rebuild it the next time there's a pandemic. First of all, it's needed all along. These the things that we were able to advance in our organizations are really basic public health functions that were needed all along. There just wasn't funding for. But second of all, it's really needed when there's a public health emergency, and the public health emergencies are just going to keep coming.
Yeah.
And so how can we possibly take care of our communities in the way that we are charged to by statute and as individual human beings, without that funding. And I think, we need to be part of this very large conversation about what are our values and priorities as a state, and as a country, around taking care of each other, and how did those values and priorities show up and how we allocate financial resources.
I think people are different than they were before COVID. I mean, I honestly feel like people, their anxiety level is higher than it was. They're not as respectful of one another in a lot of cases as they were. I just feel like people are short and they're tired and they're not wanting to go through it again and they don't want to hear about it again. And I think that's very difficult. And there are people in careers, nurses that just left the field, teachers that left the field because everything was virtual and they couldn't do their job the right way. People in public health, health directors that left the field because they were tired. And I think if it were to happen again, my question is always, if this happened again tomorrow, would we be ready for it? And I think I see a lot of heads going, I don't know that we would be able to do what we did before, nevertheless try to even do a better job than we did the last time. We hope it never happens. We hope it never happens, but it may. But again, a lot of those things that happened during COVID, they're happening now anyway. Tuberculosis concerns, people not getting vaccinated, people getting sick, housing issues, all these different things are continuing. What are we doing to address it now before the next pandemic or before the next emergency? And that's where, we're all tired. And I agree, I am tired, and it seems like it's getting harder and harder to do the job. So I think, that's where, I always wonder, like a conversation like this, like who's gonna listen to it? Because if I'm the average person, I'm probably gonna listen to this and go, a bunch of whining public health people, But there are people in public health that will hear this and be like, oh my God, I feel the same way. Yeah. I support you, I appreciate you, I like the work you do. I don't wanna misspeak about our state partners. We have a lot of legislators who advocate for us. We have a lot of state folks that advocate for us. Our commissioner advocates for us. But I just think we need to look more long-term. And a lot of those folks that advocate for us, they're in their position for a short amount of time, depending on the election or what have you. We're the ones who are in it for 20 years more. So hopefully they'll listen to our voices that we're kind of stuck in this field and we're going to be here for a while. So we want to make sure the change is long-term and not just that short 4-year period.
You said something so important, Patrick, that, this could be a whole nother hour and 5-hour long conversation. And that is just, we all have experienced this collective trauma. We experience it in a particular way in public health. Healthcare professionals experience it in a particular way. Our community members who lost loved ones, who lost their ability to function because they were disabled by COVID, have experienced it in a collective way, but in a particular way, but collectively, that nobody has not been touched by this traumatizing event that we are still living through over the last 4 years. And we just don't have the tools in our society to stop and say, wait a second. We all deserve some space here. We need to process this. Our culture is just about brushing that under the rug and moving on and recovering. And, it's harmful to us all. Boy, this really is going down.
I'm fighting tears. I'm like, how do I get out of here? But no, I appreciate the honesty. I mean, in writing these questions, how I think you all hit so much. And I think, Stephanie, take us to, I think, this piece about who our intended audience is that it's for everyone. Yeah. And I mean that really intentionally because we talk about it based on where we sit. You have different perspectives. Right. But I've always, I think when Stephanie and I talked about, we're doing this work, it really is sharing what we do with everyone else so they
Yeah.
know how to get more involved and understand how things work to, in turn, Stephanie, you can take us on home.
Yeah. So like, how do folks in the community get involved in local public health initiatives and maybe even advocacy? So like, it's not just you all doing it. It's it's a shared experience.
Right. You want to start?
I think that there's, lots of ways, and I really appreciate that conversation. We just finished, actually, released our new 5-year strategic plan and implementation plan, and, I invite our community members to, it may sound boring to read your health department's strategic plan, but our community members really are our partners in advancing equity and health and well-being in our communities, and they're integral parts of us accomplishing the goals and objectives in that plan. So, understanding what happens at your local health department, engaging with those programs, sharing the information we put out on social media. Our reach on our social media page is not nearly as big as Stephanie's reach on her social media page. So when I release a flyer that says, hey, we're having a vaccination clinic on Friday, and 20 people see it, but then when Stephanie shares it and 500 people share it, that's important, and it's part of making our community healthier.
See, I see people, we've done a lot with our marketing, just to let people know who we are and what we do. I remember we did a strengths, weaknesses, and opportunities and threats analysis with my board years ago. And they said the people who need our services generally can find us, but the people who pay for our services, who vote for our services, they don't always know what we do. So we're trying to get the word out so people know a little bit more about who we are and what we do, because it is confusing what's a health district in Connecticut or a health department. So we want to educate those folks so they can advocate for us. But interacting with our website, our social media, looking at different health districts' social media, you're going to see where we are and what we're doing and what's important to us on a daily basis. So if you're a landlord and you purchase a property, rather than wait for us to issue you an order about lead, if you can support us in that public health intervention of making that home safe before you ever have a child poisoned in it, that's public health. If you can go to a restaurant and you see a problem and you notify us, you're part of public health. You're notifying us. If you know that your neighbor next door is struggling with something, lack of heat, lack of water, whatever the case may be, if you can talk to us and we can connect you to whatever services they may need, you're helping us. I mean, it's all about prevention. We're trying to prevent one person who's sick from making 2 or 3 other people sick. So we may not be able to help that one person, but once we find that one person, we want to help them so they don't make everybody else ill. Or maybe there's nothing they can do about being sick, and we want to support that person so they can get better. And there's a lot of people, like we said, struggling in our communities. Mental health is a huge issue in our communities right now for everyone. And a lot of it, again, is there's limited resources to provide to folks. So it's trying to provide those supports, connecting them to care as soon as possible. And we do a lot of that work. It's knowing where people are, so making sure people are vocal and say these are issues in our community and we want to invite you to that table. That's also really important. So that's where we can't be everywhere, but we want to be part of that conversation so that way we can be a part of the solution. That's been our take for years.
Excellent.
We so appreciate the both of you for giving up your time and your very, very busy schedules.
Yes.
We appreciate
join
it.
us on Health
Yes,
at
thank you. And your honesty and your support and everything. I can't thank you all enough as well.
Wonderful, wonderful, wonderful.
And it's nice to highlight the relationship we have. I don't think people always understand.
Right.
We've always talked about that with health directors, is you'll get a call and you'll get towns who say, we're thinking we don't like our health department, our health district, and we'd like to join this other one, and what can you do for us? And we're like, hey, we're really not here to sell our district over another one or our health department, or we'll tell you what we think a department should be doing, and then maybe you can take that back and talk to your health director or whoever and say, this is what we hear should be done, and And are you doing those things? And more often than not, you find out they actually are doing those
Yep,
things.
yep.
It's just having a conversation. So first go to your health department, see what they're doing, and then if there's needs. But we're not in competition with one another.
Right.
And you wouldn't be in this business unless you cared about people.
Right.
You know, it's not the kind of business that you would do if you aren't invested in it.
Yeah.
And I think you can do it for a little bit, but you're not going to be able to sustain it.
Right.
So the folks like us who are in it for a long amount of time, I think you are in it for a reason.
Yeah.
And it's your life. I mean, it really is. You know,
Yeah.
your weekends are spent doing this. Your
For sure.
weekdays are spent doing
For
this.
sure.
You think about it at night. You go to bed at, and it's all about how we can make our job, our community, our staff better in the long run.
I love
And
that.
that's our goal.
And again, we want to thank our sponsors, the Connecticut Health Foundation,
Yes.
for making health equity CT possible, and thank our guests, two of the greatest health directors around,
Right.
coming to
Right.
visit us today.
That's right.
And thank you all for listening, especially those of you who made it to the end. And that's who I really want to thank, who made it. See you all soon.
Yeah.
Thank you.
Signing off.